Hello, everyone. So today I have the pleasure of speaking with Dr. Hurst Peacock from Auburn, Alabama. Great to talk with you today, Dr. Hurst.
You too, Bryant. Always good to talk to you.
Thank you. So tell me, how long have you been practicing now, doctor?
15 years.
Excellent. And how long have you been a client with AMI?
We signed up at the very end of the year last year. So, we really kind of got kicked off in January of 2020. So that's what, 6 months?
Sounds about right. Okay. So, Dr. Hurst, I wanted to take a few minutes and talk with you about your recent success with implementing our AMI DME system. Why did you feel the need to implement this program?
Why did I feel the need to implement the program? Well, because my coaches at AMI told me to implement the program. And what I have learned is that it is in everyone's best interest, my patients, myself, and everybody else, to pretty much do what my coaches tell me to do. Honestly, we were a little slow to implement it just because I had some misconceptions about DMEs and about using bracing. Um, I have always kind of been hesitant to do that because my concept has always been, well, if the patient is wearing a brace all the time, then their own muscles will atrophy. And what I want to do is build their muscles up. I want to make them more functional. And what happened was Amanda at Azon, who I'm sure you know is really awesome, they send out research on the bracing, on the DMEs. And she started sending me some stuff that basically the research proves that it's actually the opposite is what happens. Because patients are able to move more with less pain, they do move more with less pain and their muscles actually become stronger. One of the other things that really kind of got me on board with it was looking at the research about how much less pain medication patients take when they have one of these. Then the third thing was I didn't realize that you didn't have to wear these all the time. So once I learned that, somebody, maybe they're in pain or maybe they're going to do something that might make them kind of have a flare up, they can put it on for 15 or 20 minutes and it actually really helps them and it keeps them from taking pain medication and it enables them to do more than they would have been able to do before. Once I kind of got that through my thick skull, then it was like, oh yeah, we're getting everybody one of these that we can possibly get one for.
Understood, and thank you. Now, what percent of your patients have qualified for a brace since you started?
Since we really got cranked up on it, and I really, we had Dr. Paul that was calling us for a while there and sort of helping us figure that part out. Part of the DME system is kind of getting that coaching. Once I kind of figured out how to qualify people for it, upwards of 80%, somewhere between 80 and 90%.
That's really good. Now, what are some of the benefits your patients have experienced?
So what benefits have our patients seen? Man, it's been tremendous. We've had patients that even though we've given them the chiropractic care, even though we've been taking them through rehab exercises, maybe they just had a severe degree of degeneration when they came in, and that wasn't quite enough to keep them from having frequent flare-ups. We've had several patients like that we get them a DME, we get them a brace, and it makes all the difference in the world. It enables the other treatment to be effective. Whereas before, they might have been too far gone for us to be able to help.
Okay. And did you find the coaching on DME program useful in implementing the program?
I absolutely found the coaching beneficial. The coaching basically took my mindset away from, well, we may just have a knee problem and we may just have a low back problem, to get me to hunt for other things that could be happening with that patient. For example, they may have low back pain, but it may be a result of the fact that they have degenerative arthritis in their right knee, and they may be compensating and causing the low back pain. So sort of training me to hunt for that was a big deal in figuring this whole thing out.
Okay. And approximately how long did it take for you to successfully implement the AMI DME system?
Well, once we sort of figured out the benefits of the bracing and we really hit it, full bore, it was immediate. I mean, I believe we delivered something like 54 braces in April or something like that. And that's when we really started jumping all over it. So, and I think we did a similar number last month. So yeah, I mean, it was pretty much immediate.
Okay. And did this program meet all of your expectations? If so, why?
I would say that this program exceeded my expectations, both in terms of the results that we were able to get for the patients, and also, I mean, listen, the more you can help people, the more exchange you're going to create. And the way that we sort of exchange value in our society is with money. So we were able to help people a whole lot more, and it resulted in us having our two, biggest revenue months ever in April and May. In April, my state was still in a COVID shutdown in April. And we still had one of our best months ever.
Wow, that's awesome to hear. Now, Dr. Hurst, what would you say to a doctor that is thinking about implementing the AMI DME system?
What I would say to a doctor that's thinking about implementing the system is you probably are going to kick yourself that you didn't do it yesterday. It's going to help your patients. It's going to help your revenue. You're going to be exchanging more value. More people are going to be getting well. And listen, we're talking about getting well without drugs, without surgery. There's nothing harmful about it. There are no side effects. It fits right into the philosophy that we're trying to espouse. There's no reason not to do it.
Well, Dr. Hurst, I do want to say thank you so much for taking the time to talk with me about the AMI DME system. I'm really happy to hear that you're doing so well with the program. Thanks a lot for your time, Dr. Hurst.
Absolutely, Brian. It's my pleasure.